As parents, we are all concerned with the health and well-being of our children. As a parent with a child that has epilepsy, you want to do the best you can for them. You may also worry about what the future will bring. Seeing your child experience a seizure can make you feel powerless and frightened. That's why it's important for you to have as much information about your child's diagnosis and the potential treatment options available.
A seizure is uncontrolled electrical activity in the brain that occurs when nerve cells fire electrical impulses much faster than normal. Seizures may be generalized, meaning they involve the entire brain, or they may be partial.
Partial seizures begin in a specific part of the brain and may affect only one side of the body or may affect the entire body. Seizures can cause strange sensations and behaviors, convulsions, muscle spasms, and loss of consciousness. When a person has 2 or more seizures, they are considered to have epilepsy. Epilepsy can get worse over time, but it can also get better. Treatment is essential. If epilepsy is not treated, seizures can occur throughout a person's life, and in some cases can become more severe and frequent. Quality of life can be affected, as can a person's independence and self-esteem.
For children, seizures can interfere with all facets of a child's life: schoolwork, behavioral development, and activities. The most common treatment for epilepsy is anti-epileptic medications. However, more than 25% of pediatric patients are unable to control their seizures with an anti-epileptic medication currently on the market. There is a medical research study being conducted on an investigational medication for the treatment of epilepsy. Before a medicine is made available to patients, medical research studies take place to see whether the medicine is safe and effective. Medical research studies must follow strict rules set by the Food and Drug Administration and must be approved by an Institutional Review Board, or IRB.
Doctors are conducting the Periwinkle Study to determine the effect of an investigational medicine in combination with standard approved treatments in children with epilepsy.
If your child is between 4 and 16 years of age and currently taking between 1 and 3 anti-epileptic medicines to control seizures, you are invited to see if he or she may qualify for this important medical research study.
All volunteers who take part in a medical research study are supervised by a doctor and other research professionals.
The medicine is referred to as the study drug because it is still being tested to determine how effective and well tolerated it is. If your child qualifies for this medical research study, you will be given detailed information on the study, possible benefits, risks, and side effects of the study drug. A doctor will review with your family what you and your child will be asked to do. Once you have discussed specifics of the study with the doctor, you will be asked to review and sign an informed consent form. By signing an informed consent form, you indicate that you understand the information regarding the possible risks and benefits of the study drug, and that you permit your child to take part in the study if he or she qualifies. If your child qualifies, you will be asked to complete 8 visits to a day clinic over the course of 23 weeks.
Families will be reimbursed for their time and travel.
During the course of the study, participants will receive the study drug being tested, or a placebo, which looks like the study drug but contains no active ingredient or medication. Parents will need to administer the study drug twice daily in either an oral liquid form or as a capsule. Once the study has been completed, participants may be eligible to receive the study drug for an additional year.
When your child takes part in a medical research study, participation is voluntary. That means you have the right to take your child out of the study at any time.
If you ever have any concerns regarding the study or questions about the medical care your child receives, we urge you to talk with a doctor or a research staff member. You also may contact an IRB representative at any time. If your child is between the ages of 4 and 16 and experiencing seizures as a result of epilepsy, please consider participating in the Periwinkle Study. Ask your doctor for more information on the Periwinkle Study and if your child may be eligible to participate.